Hello, good morning. This is Nurse Joseph Makasa, nurse practitioner student. And today I'm conducting a video for MSN 572 Health Assessment. And today is the 11th of January 2026. And before I proceed, I will conduct a 360-degree view of my room. Hello, good morning.
Good morning.
All right. So my name is Joseph. I'm your nurse practitioner student for today, and I will be conducting your annual health assessment. Today is 11th of January 2026. How was your day today?
I'm okay, I'm fine.
Okay. So I will begin this video by obtaining consent from you. Do you consent my recording for this health assessment? And I will upload it to the YouTube as an unlisted video for my instructor to view and grade.
Yes, you may.
All right, thank you. So I already washed my hands prior to this assessment. Okay? So thank you. The purpose of today's visit is to review your overall health and also addresses any concerns and provide preventive care. And everything we discuss is confidential. Do I have your consent again?
Yes.
All right. So before we begin, can you please state your full name and date of birth, please?
I am Jane Doe. I am 35 years old and I was born December 5, 1990.
Okay. So would you like me to address by your name?
Yes, you may call me Jane.
All right. And how old are you?
I am 35.
Okay, 35 years old. All right. Can you tell me your race and ethnicity?
I'm Asian and I'm a Filipino.
Okay. Awesome. So, what brings you in today?
For today, I'm here for my annual physical exam and assessment,
Okay,
wellness assessment.
great. So, how would you describe your overall health for today?
I'm fine.
Have you experienced any recent changes such as fatigue, weight changes, fever?
Not really.
All right. Any pain, headaches, dizziness, chest pain, or shortness of breath recently? No. Okay.
Okay.
Any changes in appetite, sleep, bowel habits, and energy levels?
Not really.
All right.
Okay.
From 1 to 10, how was your energy level for today?
Today, I think I'm an 8.
8 over 10.
Yes.
All right, amazing. Now let's talk about your past medical history. Okay. So, do you have any chronic medical conditions such as hypertension?
No, I have no medical condition.
Okay. How about diabetes or asthma?
No.
None. Okay. Have you ever been hospitalized or had surgery before?
I have been hospitalized, I think, 10 years ago for a vertigo.
Mm-hmm.
And ever since, the symptoms had not recurred.
Okay. Have you taken any medications for the vertigo before?
I was given betahistine
Mm-hmm.
3 times a day.
Okay. Thank you for that.
Yeah.
And are you currently taking any prescription medications such as over-the-counter medication or herbal meds, vitamins, or any supplements?
Yes, I'm taking multivitamins plus zinc for my immune system.
Okay, multivitamins and zinc.
Yeah.
Thank you. And do you have any known allergies to medications?
I'm allergic to penicillin.
Okay.
I usually get hives. And no dyspnea.
Okay, no dyspnea, but you have hives when you took the penicillin before.
Yeah.
How about any allergies to food and environment?
I'm allergic to shrimp and seafoods.
Okay. Allergic to shrimp and seafoods. Thank you for that. How about your immunizations? Are they up to date?
Yes.
Okay. What are the immunizations that you took recently?
I had my HPV vaccine for cervical cancer. I already received 2 shots. And also had flu vaccine.
All right, flu vaccines. How about
And the COVID.
okay, so you already have your HPV vaccine, your flu and COVID vaccines too.
Yes.
All right, amazing. All right, so let's proceed about your family history. Okay, so are you both parents still alive, and how is their health right now?
My mother is alive and my father is alive. My mother has no known medical conditions. My father is both hypertensive and diabetic.
How about your mom?
None.
Okay. And how about your maternal grandmother, maternal grandfather?
My maternal grandmother and grandfather are both deceased.
Mm-hmm.
My grandfather died of ACS,
Mm-hmm.
and my mother died. My mother, my God, my grandmother died of, I think, lung cancer.
Lung cancer, okay. So again, your grandfather died of heart attack or ACS.
Yeah.
Then your maternal grandmother died of lung cancer. How about your paternal grandmother and paternal
My
grandfather?
paternal grandmother died of a hypertensive
Mhm.
disease during pregnancy,
Mm-hmm.
and my paternal grandfather is still alive.
Okay. So how many siblings you got and any
I have
disease?
one.
Uh-huh.
My younger brother, he has a kidney disease.
Kidney disease. Okay. Thank you for sharing that. And let's proceed to social and lifestyle history. Okay.
Okay.
So what is your occupation or job right now?
I'm a teacher.
Mm-hmm. And what do you teach?
I teach high school students subject of science.
Okay. High school students and science. Oh,
Yeah.
that's a great job. Thank you for your service. All right.
You're welcome.
And right now, who do you live with in your home?
I live alone.
You live alone. Okay.
Yes.
Do you feel safe at home?
Yes.
Mm-hmm. Do you smoke, vape, or drink alcohol or use any recreational drugs?
No, I don't do that. I don't have any vices.
Mm-hmm. Okay. And how will you describe your diet?
I'm more on a meat person.
Mm-hmm.
I eat less fruits and vegetables,
Mm-hmm.
and I also drink less water.
Okay. So now we can modify that one. Okay. So you can do like eat more fruits and vegetables, eat more water, and less meat. All right. We will try our best because especially right now, the holiday is over and we can modify our diet once again.
Yeah.
All right. And how often do you exercise this week or for a week?
I have sedentary lifestyle. I don't do exercise.
All right. Yeah, so after big holidays, so we need to like lose some weight so we can do go back to exercise once again. We can start with a little bit of walking for 30 minutes. Then after that, we can progress a little bit going to like more extensive exercise like weightlifting, or you can add some more recreational activities for that, okay? And again, how many hours of sleep do you usually get in a day?
I usually have 5 to 6 hours of sleep in a day.
Okay. And how would you describe your stress level?
Usually, I'm okay. I'm not so stressed.
Mm,
From 1 to 10, it's like a 6.
6 out of 10 stress level, okay? And any history of anxiety or depression?
None.
None. Okay. And how do you manage stress when you come at work, then you're so stressed, so how will you cope up with it?
I usually call my mom and I go shopping.
Mm-hmm. Go shopping with your friends or alone or
Alone.
alone? Right. Okay. So we will discuss about your spiritual affiliation, okay? So what is your religion?
I'm a Roman Catholic.
Roman Catholic. And are you active at church?
Not really because I'm busy at work.
Okay. So about in your ADLs, activities of daily living. In your usual day, what do you usually do?
At work, I usually teach children, and prior working, I cook breakfast, I go to work. Then after that, I do my lesson planning before going home. Then at home, I usually watch television. Then before I go to sleep.
Okay. As long as you know how to manage your stress, right?
Yeah.
Okay. So let's proceed to women's health. Okay, I'm going to ask a few questions, routinely questions about your sexual health. I ask this to all of my patients, and everything is confidential. All right. So, when was your last menstrual period?
Last December 2025.
Okay. Are your cycles regular?
Yes.
Any abnormal bleeding, pelvic pain, or discharges?
I think about 6 months ago, I had scanty abnormal bleeding.
Mm-hmm.
Maybe it's associated with the use of implant.
Okay. Like birth control implants.
Yes.
Okay. And can you name those? What's the name of that implant, if you mind? Can you remember?
Can't remember.
You can't remember. Okay, it's okay.
Just subdermal implant.
Okay, it's okay. Now, Are you sexually active?
Yes.
How many sexual partners have you had in the past year?
I had past year.
Yes,
Only had one.
one. Okay. Do you have sex with men, women, or both?
Man only.
Men only. Okay. So is your partner monogamous?
He told me.
Yes. All right. He told you. He told you yes. So
Yes.
okay. Practices. What type of sexual activity do you engage in? Vaginal sex, oral, or anal?
Vaginal.
Vaginal only. Okay. And do you have any pain, discomfort, or concerns during intercourse? None. Okay. And what do you do to protect yourself from sexually transmitted infections? Infections.
Use of condoms.
Condoms, all right. And do you use condoms consistently?
Sometimes.
Sometimes. Right. So have you ever been diagnosed with sexually transmitted infections?
None.
All right. When were your last tested?
I think a year ago.
A year ago. Have you or your partner had any symptoms such as discharge, sores, or itching?
None.
Okay. And are you currently trying to become pregnant?
No.
No. What form of contraceptions are you using right now?
I'm on pills.
Pills, like oral pills.
Oral pills.
Have you ever been pregnant?
Yes.
Yeah, and how old is your
My son is
son?
already 6
All right.
years old.
And how many times you get pregnant?
Only once.
Only once. All right. Okay, so thank you for that. Thank you for your honest questions. And let's proceed to the review of your systems, okay, from your all of your vital systems in your body. So, in general terms, how was your current situations right now? Current health situations right now?
I think I'm apparently well.
So, any fever, fatigue, or weight changes recently? None. Okay. How about vision problems? Do you have any? Are you wearing any contact lenses or prescription glass?
I'm not wearing those.
All right. Any hearing loss and headaches?
None.
None. Okay. And for your cardiovascular, do you have any chest pain, palpitations, or swelling, sweating?
No complaints.
No complaints. All right. How about in your GI, gastrointestinal? Do you feel like nauseous, vomiting recently?
No.
No. How about any diarrhea or constipations recently? No. And for your genitourinary system, how about your urinary frequency? How was it? How often you do pee?
Usually, I think it's normal.
Okay, normal. Any burning sensation or discharge? No. For your musculoskeletal system, any joint pain, stiffness, or weakness?
None.
None.
But I know someone.
You know someone with joint pain? All right. Tell him or her to get a regular checkup for that, okay? So that he can take medications for it. All right?
Yes.
Any for neurologic system, any dizziness, numbness, or tingling sensations that you feel right now? All right. And for endocrine system, any heat or cold intolerance?
No.
How about being thirsty or hungry?
No.
All right. And any mood changes recently, anxiety or sleep problems? None. Okay. All right. Thank you so much for your answers. So, before we close this one, is there anything else would you like to discuss today about your overall health, and wellness?
I'm okay.
Okay.
Thank you so much for asking.
All right. So, now we will proceed with the physical examination portion of the assessment. Okay, that will be done later. But based on your history, we will focus on preventive and lifestyle recommendations like change of diet. We should eat more fruits right now, vegetables, and less meat as much as possible. And because there's another source of protein aside from the meat, you can have it in any form of vegetables or fruits, and also lesser carbs. Okay. And for your lifestyle, you should have more exercise. Like you can start with less impact exercise, such as walking for 30 minutes. Then after that, go and progress with some weightlifting if you want, or any highly activity, recreational activities such as mountain climbing, wall climbing, stuff like that, biking, right? Yeah, so hopefully you can start to modify it, especially we're done with a long holiday season and it's a new year, so it's a new life, so we can do our more things in our health better. Okay? All right, so time now is 15 minutes. All right, so can you tell me more about what are the things that you want to change, especially in this new year?
Actually, I'm planning to change my diet. I
Mm-hmm.
plan to increase my vegetables and fruits and lessen my meat intake, especially the fats,
Mm-hmm.
because it's better to prevent diseases than to treat them.
Okay. Mm-hmm. And are you still continuing um, your
Yes,
multivitamins?
of course.
Uh, and you're planning
But
to add more for it?
not really. I'm not planning anything because I think it's working for me. The multivitamins plus zinc.
Mm-hmm. All right, so for that, you can continue your healthy lifestyle and you can also do your annual pap smear.
Yeah.
Okay, you already done with your pap smear? Any laboratory
I think 3 years ago.
3 years ago? Okay, have you been doing your annual mammogram too?
No,
No?
I haven't had mammogram.
Okay. And how about, are you updated aside from your flu vaccines? Are you updated with other immunizations?
Um, yes, I had. I think I had pneumococcal
Okay, pneumococcal
vaccination
vaccines.
and also the COVID. I already received 3 or 4.
Okay, 3 or 4. Okay. And how about your you already talked about um, hepatitis B vaccines.
Yeah,
Yeah.
I already had titers.
Mm-hmm.
My titer is really high,
Mm-hmm.
so I think it's 800. So I think I'm protected from Hep B infection.
Okay. Yeah. Very good. And anything that you can add?
Um,
What are the changes between your have you already done with your laboratory test?
I'll have. I think I'll check my cholesterols.
Mm-hmm. Your cholesterol
Maybe
level.
it's increased because of my diet.
Mm-hmm. And because you have a history of um, hypertension,
Yeah,
okay, and you also have history of like diabetes, you should also have a check for that, like
yeah.
glucose
Because of my
check.
age is already
And
high.
also you can also consider having an ECG, AKG test.
Yeah.
Okay, so we can also monitor if you have any heart murmurs or heart problems aside from hypertension. Okay,
Yes.
and also your kidney test, okay, kidney functions test, because your brother also has a history of medical problems with kidney
Kidneys.
diseases.
Yes.
All right, okay, and aside from that, all right, so you are living alone and you feel safe. That's amazing. And do you have any social group that
Yes, I have my friends.
you have your friends? Uh-huh.
Yes, co-teachers at school.
Yeah.
And at times we go out together,
Mm-hmm.
have some breakfast,
Mm-hmm.
and talk about school
Mm.
and our personal lives.
Okay. Okay. And how often you visit your mom? And yeah.
I should visit my family once a year,
Mm-hmm. Yeah.
and during that time we usually go out together.
Okay. So, all right. So let's wrap up this health assessment of yours.
Yeah.
So make sure that next year you will do your annual checkup again and
Yes.
wellness check.
Yes.
And you should also, prior to that, you can also do your laboratory test in advance. Okay?
Yeah.
Your test in advance. And also your immunization
Yes.
should be at par
Yes.
and should be always be updated,
Yes.
And also, if you have any problems, you can always call us as your or call your any of your primary care provider. Okay, and as long as you have their contact numbers, and we can also contact you for that. All right, and all right. So I guess we can close our health assessment for today.
Okay.
So if you don't have any clarifications or any recommendations that we can do our health assessment better next time,
Yes.
all right? So you can also email or text us for that, okay?
Thank you so much.
All right, no problem. So now is almost time. So thank you very much, Miss Jane Dell, and have a good day.
Yes. Thank you
And
so
hopefully you can change your lifestyle, especially doing some exercise and
Yes.
changes of health diets. All right, thank you.
much. Thank you.